Hello, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. As you know, this is a webinar that we're going to talk about Lyme disease. I see a lot of familiar names on my message board, and so I'm glad to see that a lot of you are coming back, that you probably are getting some benefit out of these. And then I see a lot of new names tonight, too. So for those of you that are new, welcome here. The way that you participate in these webinars is a couple ways. Number one, you can pay attention and listen to the questions as I read them out loud, or you can even read them on your screen if you're in the live version and see what my response is. And there's always a lot of good learning around the questions because I answer the question, but I use the question as an opportunity to try to explain things about Lyme disease. The second way that you can participate is to really be bold, especially on your first visit, and write a question to me. And the way that you do that is on the bottom of the screen. On the right-hand side of your screen is a chat box. And you can write your question to me there. The thing I ask is that when you're writing the question, do not hit the enter key until your whole question is complete. Don't use the enter key to create separate paragraphs. When you do that, it creates a lot of complications on my side where I have a hard time finding where the various parts of your question went to, okay? As usual, I am creating a recording of tonight's webinar, and if everything goes as planned, and 99% of the time it does, I'll be able to do a brief edit on it later this evening, and then early tomorrow morning write a synopsis of it, and then get that out to you in an email tomorrow morning. Usually somewhere between 9:30 a.m. Central Standard Time, I will get that out to you, so take a look at that. Tonight is one of our last two webinars for the month. I am having another one next Wednesday. And so in tomorrow morning's email, you can sign up for next Wednesday's webinar as well, too. So I want to just point out, I had to move my webinar from Thursday night, which was the usual time, to Wednesday night due to a scheduling conflict. And so bear with me the next 2 weeks as we do Wednesday night webinars instead of Thursday night webinars, okay? So I think that pretty much answers most of the technical side of things. Without any further ado, I think we'll go ahead and get started here. Let's see here. I'm going to take our first question. This is from Colleen. Hi, Colleen. See, my mom wants to take curcumin for inflammation, but has difficulty swallowing the thorn curcumin phytosome 500 milligram pills. She has drops that contain 720 milligrams turmeric plus 10 milligrams black pepper, and also powder that's meant to be mixed in smoothies that contains 0.75 grams of turmeric plus 0.1 gram of black pepper. Are either of these options a good substitute for the 500 milligram curcumin pills? Thank you for all you do to help guide us through this Lyme maze. So curcumin, everyone, is a component of the Indian seasoning turmeric, right? So turmeric has curcumin in it. What is active in terms of an anti-inflammatory and an agent that can help lower inflammatory cytokines in Lyme disease is the curcumin, right? So in Lyme, when your white blood cells see the Lyme infection, or in mold toxicity when they see a mold toxin, or in too many yeast in your intestines when they see too many yeast in your intestines, white blood cells manufacture these things called cytokines, and they're good and bad. On the good side, those cytokines help direct the immune system to be more active and to help draw those the white blood cells that are going to deal with the problem to where the problem area is, all right? But in Lyme disease and mold toxicity and too many yeast in your intestines, sometimes in long COVID, the immune system doesn't do a good job getting rid of the problem. And so it tries harder and harder and makes too many cytokines. And too many cytokines lead to what we call Lyme symptoms, all right? So we like to use things to lower those cytokines. And one thing that we can use is to use curcumin. Curcumin gets inside white blood cells and limits cytokine production. In terms of its absorbability, and turmeric as well too, both turmeric and curcumin are not well absorbed on their own. And that's what the problem is. So in the curcumin phytosome product by Thorne, it's a liposomal product. They microscopically wrap the curcumin in a fat substance to get it better absorbed. Okay. so both turmeric and curcumin have the same problem. One is absorbability. Now, black pepper may help with that, but ultimately you're better off finding some kind of a liposomal product. And frankly, I don't know which one that would be. I would have to do some investigation to see if I could find one for you. Okay. An alternative to doing that would be to try some glutathione. So glutathione, and you can get liquid or gel forms of that, is a very strong antioxidant. It's made in every one of our cells. And it, as an antioxidant, it decreases oxidizing agents that the immune system makes to tell white blood cells to make cytokines. So it works in a different way than what the curcumin does, in that it's working to intercept the message going to white blood cells that tell them to make cytokines, versus the curcumin is inside the white blood cells, blocking how cytokines are made. So the thing that's nice about glutathione is there are a number of gel and liquid preparations of that. And the one that I really like is a product made by Research Nutritionals called Tri-Fortify Orange or Tri-Fortify Watermelon. And what is done with the Tri-Fortify Orange and the Tri-Fortify Watermelon is that they are microscopically wrapped in fat to increase absorption. so the Tri-Fortify product would be a teaspoon once a day on that. Okay. So those are some things for you to think about. Good luck with your mom. And thanks for that question too. Hello, Sue. Let's see. My husband has been battling Lyme and Bartonella unsuccessfully for 1.5 years. No improvements from antibiotic herbal treatment, including hyperthermia at Klinik St. George. He has elevated lead and mercury levels in this developed POTS. He plans to start DMSA chelation treatment now. Should he get his metal fillings removed before chelation treatment? Do you think POTS and or heavy metals are the reasons he has not responded to Lyme treatment? So it's a complex question. So first of all, I've been operating now a group, a community, a membership community for people living with Lyme called Lyme United. And one of the topics that has come up there is the hyperthermia treatments at Klinik St. George. And generally, there's a consensus among people in that group that what Klinik St. George is useful for is Lyme, not necessarily Bartonella. Okay, so I just want to point that out to you. And even on the Lyme side, if we look at data that was published by MyLyme Data, which MyLyme Data is a program that's run by LymeDisease.org in California. And they've conducted this series of studies where they ask people that have Lyme questions, and they periodically query them and see if they will give them answers on something, okay? And so they did a study maybe about 4 or 5 years ago now, maybe 4 years ago, that asked people what alternative medicine treatments had they tried and what kind of results do they get. And what they found with the hyperthermia, I think, is about 35 or 40% of people reported improvement. Keep in mind, though, that the placebo effect of any drug we give you is about 35 to 40%. So not much different than a placebo effect. In other words, we can't really tell whether it does anything, all right? And so I just want to point that out. It may not be universally successful. I don't consider hyperthermia treatment at Klinik St. George to be an adequate treatment. I have taken care of numerous people that it failed. The people do well for a while, but then eventually it does come back. It doesn't really kill Lyme permanently. And there is this question, I think, that we're exploring within Lyme United, which is my social community, that it probably isn't effective for Babesia or Bartonella at all. Okay, so if you're saying that he had adequate treatment because he went to Klinik St. George, he hasn't, based on that alone. Okay. All right. Second thing I want to point out is that when it comes to Lyme, it takes a long time sometimes, okay? And in my experience, an average treatment length to recover from just the Lyme infection, Borrelia, can be 1 to 2 years. If you're on an effective treatment for Bartonella It often is about 6 months in about 80% of people. And if you're on an effective treatment for Babesia, it can be about 5 months in about 80% of people, okay? So the fact that you've treated for a year and a half just may mean you haven't treated long enough. I wouldn't consider that period of time that you were treated by Klinik St. George to be meaningful treatment, to be quite honest with you. And I would need to look at what else he's taken during that 1.5 year period of time to see if they put together an adequate treatment for you as well too. Okay, so I just want to point out that information to you as well too. All right, so then let me see here. Oh, in terms of POTS then. So POTS, the reason I went through all that is POTS is caused by chronic infections, okay? And so the fact that he has POTS would probably still suggest that there is chronic infection that's active in him, whether it's Bartonella, Lyme, or Borrelia. The underlying cause would be the chronic infections. I have not seen in my practice that heavy metal toxicity leads to POTS. I have seen it lead to poor immune function. I have seen it lead to low energy, but I have not seen heavy metal toxicity lead to that, okay? So everyone, POTS is a form of autonomic nervous system dysfunction. And by autonomic nervous system, I mean your adrenaline and anti-adrenaline part of the nervous system. And chronic infections can be a big thing that triggers imbalance in that. One of the chronic infections that's really heavily involved is Babesia, actually. I question if he's had adequate treatment for his underlying infections. I would just point that out to you, okay? Let's see here. So then pertaining to the question of getting fillings out when you have chelation done. So there's, when you're taking a chelation agent, like a DMSA, consider it to be a metal magnet that's going to attract metals that are floating around in you, okay? Now, the amalgams in a person's mouth, most of the heavy metals and mercury that's there are trapped in there, although there is some slight breakdown in those amalgams, and you can get some mercury vapors that kind of float above the teeth, and then a person swallows that down into the stomach, and then it gets absorbed, okay? But keep in mind that your pills that you're going to be taking, the DMSA, are encapsulated in a way that they're going to go right through the mouth. So they're not going to be leaching out heavy metals from your amalgams. Now, they may capture some of that mercury gas microscopic amounts of mercury gas that you breathe, that you swallow down into your stomach. They may bind some of that in the stomach and the intestines, and that's okay. But they're not going to leach out the amalgams. While I think long-term, it's a good idea to get heavy, if you have mercury toxicity, to get those amalgams out. I don't think it's where you start. It's very resource intensive to do that. I would save your money and get effective Bartonella and Babesia treatment, and I would save your money and work on chelation. That's how I prioritize it in my practice. Okay, all right. I hope that answers your questions. I probably gave you more information than you wanted there, but the main point I want to say is if POTS is active, there's probably still chronic infection going on. Okay, all right. Good luck to your husband, Sue. Hello, Doug. Hi, Dr. Ross. I'd like your input on my 2 real-time lab results for mycotoxins, which I had done initially in late 2022 and then again about 2 weeks ago. As of the day of the second test, I had been on GI detox for a little over 5 months. The results for those tests are respectively as follows. Aflatoxin 2.3 down to 1.265. So that's improved, I think, the way you're writing that. Tricosethine down to 0.382, gliotoxin down to 2.743, zearalenone down to 1.454, and ochratoxin A down to 7.172, but not a huge reduction compared to the original amount. So all are going in the right direction except for the ochratoxin A. Any thoughts on why so little progress in that toxin group and what I can do about it? Could it be colonized? If so, with staying on GI detox while treating for colonization work? I had my current home tested for mold this past March, and it came back excellent. However, in the past, I've lived in 2 moldy places. Thank you so much. So, Doug, what I would say is, wow, what a good improvement you've had on the test. And what I would really want to know is, have you also seen any improvements in how you feel overall as well too? Okay, so we don't just, when we're trying to see if somebody is responding to a mold toxicity treatment, we don't just look at what the numbers tell us. We also have to look at how you feel. Okay. One of the things that can happen in mold toxin illness is that these binders that we use that are designed to grab hold of the mold toxins that work their way in the intestines so that they don't get reabsorbed back into the bloodstream. Each of these toxins has, or each binder has different affinities for the toxins, all right? So it could be the reason that your ochratoxin A is not responding as quickly as your other toxins are, is that the binders in GI detox for your toxins are stronger at pulling out the other toxins than the ochratoxin. And what's going to happen is once they remove enough of those other binders, they're going to then be able to focus better on the ochratoxin. All right. So they're going to pull out first what they have the strongest affinity for, the strongest magnetic pull for, if you will. And then once those are removed to an adequate level, they will be better drawn to what is left, which is the ochratoxin. All right. So if you were in my practice, I would not change what you're doing at this point. I would continue doing the binders. I would see what happens in about another 3 to 4 months and see if that ochratoxin starts changing. Okay. Now, everyone, Doug brings up a point, and that is when you have mold toxicity, it is possible that you have something more going on than just mold toxins trapped in you. There are a small group of people that actually have mold colonized within their nose passages and their intestines, and the mold colonized in there can start producing its own toxins. And so you kind of become your own toxin brew pub, if you will. Okay. All right. But I will say that is not the case for most people. Okay. For most people, they're not a toxin brew pub. So some of my colleagues, when they treat mold toxicity, because there is a small risk that you might be colonized, they automatically put you on fungal killers that you spray in your nose and that you take to kill fungus in your intestines. All right, that's what they do right away. I disagree with that approach because in my practice, I was able to get about 80% of people well without ever having to put them on mold killers, without having to put them on the toxicity of being on a mold killer, okay? So if you were my patient, what I would do is I would say, this looks great. I would want to know more about your symptoms. And if your symptoms are improving, I would also say this looks super great, okay? And then I would consider staying on the same binder and then coming back in about 3 to 4 months and retesting again. Okay, that's what I would suggest doing here. All right. Now, let's see. There's another point I can make here, but I forget what it is. Oh, so for those of you that are not familiar with mold toxicity, I just want to do a quick 101 on it. I think most people are, but let's just talk about it quickly. So based on the work of a physician named Richie Shoemaker, about 25% of old people, when they breathe a mold toxin in from their environment, are not able to break it down or remove it. And then they become trapped in you, okay? That's of all people, whether they have Lyme or don't have Lyme. 75% of people were able to deal with those mold toxins. I'm one of those people. I could walk into a building with a cloud of mold toxins and never be bothered, okay? All right, so it happens in me, and what happens in 75% of people is when we breathe those mold toxins into our bloodstream or through our lungs into our bloodstream, some of our white blood cells will come in and tag those mold toxins, and then other white blood cells will come in and break those mold toxins down, and we'll never have another problem with them. All right. But if you're one of the 25%, what happens is those mold toxins don't get tagged. Therefore, they don't get broken down by the immune system. They go to the liver then, and the liver is not able to transform them. And from the liver, they get moved out into the intestines. And out in the intestines, because they're still a fat-based toxin, they get reabsorbed back into the bloodstream. So you just get this endless loop going around from toxins you've been exposed to in the past. And for the majority of people with mold toxicity, in my experience, that is what the problem is. It's not that they ever got colonized by mold in their environment, but rather it's just this trapped pool of mold toxins. Okay. All right. So good luck to you, Doug. For those of you that need a little bit more information here, I just want to do a quick screen share. All right, so let's see here. So this is my Lyme information site, Treat Lyme by Marty Ross MD. And as you all know, if you look under the online Lyme guide, you can find a lot of information probably about most questions you would have in Lyme disease, okay? So take a look in my detoxification section here and take a look at this mold and Lyme toxin illness article, where I talk about more about this and what different binders do, and when it might be appropriate to actually start killing mold that might be colonized in you as well too. Okay, all right. All right. The other thing I just want to point out, this was on my screen initially. So I have set up an online community for people living with Lyme. It's called Lyme United, and many of you may be familiar with it. I did mention it earlier tonight in that I'm helping people here, and people are helping each other. This is a community. We're working together, people living with the illness, with input from me. We're finding solutions for people, okay? I mentioned this earlier because there's been some good discussions here about what the benefit is of a Klinik St. hyperthermia. We have many other good discussions here. And we're open for members, okay? So anyone can become a member. If you want to become a member, take a look at my Lyme United tab here on my education site. Read through this and just see if this works for you. We recently, to help people join, we recently have changed the fee structure, and we're now offering this for 30 days free. So you can become involved in our group and have the initial 30 days for free. And then there is a membership fee that kicks in after that. Okay. So take a look at this later and see if this is right for you. Okay. All right. Let me go back here. All right. Thanks for that question, Doug. Oops, let's see. Colleen, looks like I see that question again. Let me get rid of that here. Hello, Lynn. Let's see. Hi, Dr. Ross. My mom, who is in her 80s, was bitten by a tick about 2 months ago. She told me recently that she has been feeling fatigued for a while. She's not sure when it started. And about a week ago, she had been feeling nauseous for about a week. She was taking lots of supplements, and nausea has improved since stopping them. She has also been having increased pain in her arthritic shoulder and her already problematic SI joint. All of these symptoms could be explained by other things, which is why it's taken us a while to connect the dots that it might be Lyme. Number one, would you recommend immunoblot testing? And if so, for what co-infections in addition to Lyme? 2, should she start something like some cryptolepis or knotweed for some broad coverage while waiting for more info? 3, she's likely to prefer antibiotics to herbals. So is there any prescription combo you recommend with the information we currently have? Okay, so hold on a minute here. I just have to look back. So she's got fatigue, some nausea that got better by pulling her off supplements, and more joint pains. That's what I'm hearing, is fatigue and joint pains. Okay. So it would be useful if I could ask you a lot of questions too. And if I were to ask you a lot of questions, I would really try to ask you things about how many different Lyme symptoms does she actually have, okay? I would want to know how her thinking is. Did it get worse? I would want to know, has she developed insomnia? I would want to know, does she also have muscle pains? I would want to do a review of Bartonella and Babesia symptoms to see if she has any of those. So Babesia symptoms can be night sweats, can be panic attacks, can be frontal headaches, can be getting lightheaded easily, standing up, can be feeling shortness of breath, or we call that air hunger, okay? Bartonella symptoms can be severe cognitive or thinking problems, can be a pain on the soles of the feet, can be a lot of neuropsych issues like depression and anxiety, can be tremors, can be shakes, can be a lot of muscle twitching, all right? So I'll show you some articles here in a minute, but if your mom has some symptoms that we would put in the Bartonella camp, or your mom has some symptoms that we would put in the Babesia camp, then I might proceed with testing for those as well too, all right? But my approach in situations like this is to try to make sure there isn't something else going on, especially in an 80-year-old, all right? So I hope that she has seen her primary care doctor, who should be doing the standard things. She should have had some kidney liver blood testing. She should have blood counts. If she's fatigued, they should have done thyroid studies on her. Anyhow, the basic stuff. They should be doing that kind of workup with their even blood counts as well too, okay? But if you've done all that and they're not finding any explanation for this, then yeah, I would start considering, could there be tick-borne illness? So in terms of if there are not many symptoms of Babesia or many symptoms of Bartonella, I would focus primarily on the Lyme germ. And that test I like to do is the immunoblot method by IGeneX. As many of you know, I now consider that way of testing for Lyme, Bartonella, and Babesia to be the most sensitive. That means it has the best ability to find if you have those infections in you, okay? It is a rather expensive test, but it's most sensitive. The other thing for Lyme, it has the ability to pick up infections from 8 different strains of Lyme. For Bartonella, it can pick up infections from 15 different strains of Bartonella. And for Babesia, it can pick up infections from 15 to 20 different strains of Babesia that might infect a person, okay? So that's why I call it the best test, all right? All right, so in terms of whether you should test beyond that, then you need to consider, are there enough Bartonella and are there enough Babesia symptoms that make you wonder, all right? So let me just do a quick screen share here, and I went through those symptoms, but I'm going to show you where you can find those symptoms again, all right? All right, let's see here. All right, so in terms of the symptoms, let's look at the online treatment guide here. And in terms of symptoms, take a look in my how to diagnose section. And in my article on chronic Bartonella, I walk through the symptoms that would suggest Bartonella. And in my article called How to Diagnose Babesia and Chronic Lyme, I walk through those symptoms as well too. Okay. All right. So Lynn, thanks for that question. And good luck to your mom. Oh, given her age and sensitivities that older people have to medications, even herbal medications, I would probably wait to get your testing done, actually. Okay. All right. Good luck. Hello, CJ. Hi, Dr. Ross. Thanks for hosting these informative sessions. You're welcome. Would you comment on the pros and cons of statin drugs? Is there any case in which you would prescribe them? Thank you. So I would not consider myself the best expert on statin drugs because I haven't, obviously, I have focused more on fatiguing illnesses, chronic Lyme, etc. Okay. I'm not the best expert here, but I'm just going to give you my 2 cents on it. So having warned you, I'm going to give you my 2 cents. So I think that I have taken a look at a lot of the Canadian data, and in Canada, they are tending not to recommend statins the way that we do here in the States, because their data actually suggests, although lowering cholesterol with a statin can be useful at preventing heart attacks and heart conditions, people still die at about the same time. It doesn't seem to change the long-term outcome for a person, either in terms of their relative health status or in terms of when they die. And the issue is that perhaps lowering cholesterol may harm a person, actually. I mean, you need cholesterol to make all your functional hormones, for instance, okay? So I am not a big proponent in using statins because of a potential side effect problem they have, especially in Lyme disease. In Lyme disease, we already have a lot of myalgia muscle problems, and the statins are notoriously known to do that. Statins interfere with CoQ10, which is a critical cofactor in how your mitochondria work, and which we already know that your cell energy factories, mitochondria, are under strain. I don't want to do something else that's going to put them under strain, okay? Now, situations that I might recommend that somebody followed through with their cardiologist's recommendation of a statin is if there is known severe cardiac disease in the person's family and early death from that cardiac disease. That might be a situation where I would recommend they consider taking a statin. But generally, I think we've gotten too caught up in the hubris of pharmaceutical companies that have done a great job of stacking expert panels with representatives of their own representatives. And I think it's all skewed right now. I think the Canadians actually have the better approach to this. Okay. All right. There you go. Thanks for the question. Let's see. Joanne says, how come I can type this in the admin box, but not in the chat box? I'm not sure. I would have to sit down and see what's happening on your side of the computer, but I'm glad you're able to type something in here. Hello, Nancy. Let's see. Hello, Dr. Ross. What would be a good protocol to treat Bartonella and babesiosis concurrently? My recent IGeneX test showed negative for Lyme, but positive for Barton Babs. Thanks for all you do. All right. So let me make some comments about your recent testing that seems to show Lyme may be gone. All right. And I want to start there. Hold on just a minute. Okay, so once you have had a positive Lyme test, repeat testing is not accurate at showing you if your infection is there or is gone. Okay. I know there's a lot of my colleagues that are going out and repeat testing either with their T cell activation test, also called an ELISpot, or by repeating the antibody test, immunoblot and Western blots. And they feel that if the antibodies are gone in an immunoblot or Western blot, or if the T cells are no longer as reactive, that's proof that the germ may be gone. All right. And what I want to let you know is there's no validation of those points. So when it comes to antibodies, we know with people living with Lyme that antibodies, even when they have active infections, will come and go. So you can have a raging Lyme infection that is making chemicals that suppress your immune system so that it can no longer make the Lyme antibodies, okay? So not seeing any antibodies could mean it's because your Lyme is just partying on and having a good time in you, all right? It doesn't prove your infection is gone. Same point with the Ella spot. Your Lyme germs could be just partying on, having a good old time in there, releasing chemicals to suppress the immune system. And that's why the Ella spot is negative. It doesn't prove the germs are gone, all right? So now I don't know your original situation. If your original situation was that you never have had Lyme, there was never a positive test, and that you're always been Bartonella babesia, well, then that's fine, okay? But if you're saying because a test is negative for Lyme that you no longer have Lyme, there is no such test. There is no test that proves that an infection is gone. Now, my colleagues, we as physicians are taught to test for everything. And a lot of us feel better if we see something on a test that validates an idea we have that maybe a person's doing better. But I will tell you, there's no validated way of seeing if Lyme, Bartonella, or Babesia infections are gone. There is no valid way of testing for that, okay? All right. So sorry to say that to you, but if your question is how do you treat Bartonella babesia at the same time, I can give you some ideas on that. All right. So let's see here. So an interesting way herbally, I'll start there. Herbally, that you could build a Bartonella and Babesia treatment is to use an herb called cryptolepis. Cryptolepis is an herb we have historically used to treat Babesia with pretty good results. It works about 80% of the time. And then about a year ago now, maybe about a year, maybe even less than a year ago, there were some experiments conducted looking to see in the laboratory, does cryptolepis have effects also against Lyme and Bartonella? And what those studies tell us is that in a lab, cryptolepis is quite effective at treating growing as well as persister Lyme and Bartonella, all right? So for those of you that are new to all this, Lyme and Bartonella can exist in a growing state, and a very small percentage, maybe 5 or 10% of the germs can go into a hibernating state. We call those persisters. And the idea of persisters is relatively new, maybe about 5 years or so. We've been looking at that. But we think that because the germs go into persisters, that may be why we're having a hard time getting rid of Lyme infection in a small group of people. Those persisters need special treatments to get at them. And since our discovery of persisters about 5 years ago or so, there's been a lot of laboratory experimentation going on looking at, well, how do we deal with them? All right. And so some of those studies have looked at this idea of using herbal options. Okay. So cryptolepis could be a useful drug or herbal antibiotic to start. When I'm using it to treat Babesia, I'd like to have people on a teaspoonful, so pretty heavy dose, 3 times a day. If you are using it just for Bartonella or Lyme, I usually will go at half that dose, a half teaspoon 3 times a day. But for Babesia, I find it most effective at a teaspoon 3 times a day. Okay. All right. In addition, to get at the Bartonella, crypto on its own will not be enough, but you could combine that with another Bartonella herb, like you could combine it with a Sitta acuta, or you could combine it with a Hutania, or you could combine it with a Japanese knotweed. And if you were to do that, I would take that other herb, not all of them, but pick one of those, all right, any of them, and you want to work that up to 30 drops twice a day. Okay, so you could go after Babesia and Bartonella with a 2 herbal antibiotic protocol. All right. All right. Now, if you were to do it prescriptively, all right, so then just to go over the how effective herbs are. So herbs for herbal antibiotics for Bartonella will work about 70-75% of the time. For Babesia, they're going to work about 80% of the time or so. Okay. By comparison, prescription options for Babesia will usually work about 85% of the time. So any one that you start on has an 85% chance. That means even if you change to a different one, it also has an 85% chance, okay? And in Bartonella, the prescriptions have about an 85% chance as well too. And if the first drugs you go on for that don't work, then you would switch over to a second set and hopefully that will work for you, okay? All right. So having said that, if you were to do this as a prescription only regimen, I might look at doing an herbal or a prescription antibiotic called clarithromycin, which is in the same family as azithromycin. And that's 500 milligrams twice a day. That's both part of a Bartonella treatment and a Babesia treatment. In addition, I would get on a specific anti-malarial medicine, which is called Malarone. And in an adult, I would take one pill twice a day on that. And then to strengthen the Bartonella side of the treatment, I would do fluconazole, also known as diflucan. It's an anti-yeast medication, but experiments conducted at Johns Hopkins maybe about a year and a half ago, or no, maybe about 3 or 4 years ago, showed that the family of drugs that fluconazole is in, they're called the azoles. One of the representative members of that family, called clotrimazole, was really effective at getting at growing and persister Bartonella in the lab, okay? So if you were to, and that would be 200 milligrams one time a day. So the Bartonella treatment would be clarithromycin, 500 milligrams twice a day, with fluconazole, 200 milligrams one time a day. And the Babesia treatment would be clarithromycin coupled with the Malarone, one pill twice a day, all right? So it'd be a 3-drug regimen. And I already gave you my herbal ideas for your the herbal side, and that's a two herb antibiotic regimen. Okay, all right. Good luck to you, Nancy. Hello, Joyce. Hi, Dr. Ross. I recently had an organ screening ultrasound done, and my thyroid has 2 nodules. Hold on here just a minute. So I recently had an organ screening ultrasound done, and my thyroid has 2 nodules. A few weeks back, you answered my question about bursts of hot flashes, feeling exhausted and having chest pain, among other more minor symptoms. Have Lyme and Bart predominantly for 22 years this month. Had a 4-week prescription of Doxy when initially diagnosed due to bullseye rash and flu-like symptoms in 2001. Clearly, the Doxy did not do anything except bury everything deeper into my tissues, because as the years progressed, I had many strange things going on, but every doctor dismissed these as being neurotic and age-related, etc. I'm now 64. My level of frustration is great. Would you please speak to the long-term effects of Lyme, etc. on the thyroid? I will be going for a complete thyroid panel soon. In Arizona, we can order any blood work we want as long as we pay for it out of pocket. Could being on the herbs, Sida, Kuda, Hutania, Casca, Toba, Bark, Japanese knotweed, cryptolepis, I think there's a second part to your question here. Yep, here we go. Continued too long, 1 2 years, be causing side effects. I'm desperate. I have been hypothyroid for as long as I can remember, but every doctor has refused to do the complete panel and says I am in normal range. Aside from you, are there any good doctors out there? Thank you for sharing your knowledge. I truly appreciate everything you do for this Lyme community. All right. So thank you, Joyce. I appreciate the kind words there too. So I am not, there have been no studies conducted about the long-term consequences on different organs in the body from having chronic, untreated or poorly treated tick-borne infections. No one's done that, okay? And keep in mind, the reason no one's done that is, remember, most of the medical community is in denial that there is something called chronic Lyme and in chronic Bartonella and in chronic babesiosis. They just don't buy the concept, so they haven't put any money into following what happens with people. In my own experience managing chronic tick-borne infections for nearly 20 years, I have not seen a higher percentage of people than I might expect in a general population develop nodules on their thyroid. Okay, so if your question is, are these nodules that you are seeing on your thyroid due to having chronic Lyme? I don't know. I honestly don't know. It's possible that you develop those on your own as well too. Okay. Now, I would agree, and I have not seen the herbal antibiotics that you mentioned earlier affect the status of how the thyroid is doing. In other words, when I have put people on the herbal antibiotics that you're on, I have not seen anyone develop hypothyroid disease or hyperthyroid disease. I have not seen that happen in any of those people as well too. Okay. All right. Now, in terms of testing, you probably already know this, but people with chronic Lyme can develop two types of thyroid disease. All right. There's one that I will call central hypothyroidism, and there's another one I'll call peripheral. The average doctor is only trained to look for what is known as central hypothyroidism. They are not aware that in chronic illnesses like Lyme disease, you can develop this problem called peripheral hypothyroidism. All right. So let me just briefly describe the differences between those two. All right. And then point you to an article for those of you that are interested where you can get more information about the testing I recommend and how you proceed in terms of handling it. All right. All right. So there's a central hypothyroidism. There is an area of the brain called the hypothalamus pituitary that works together to determine, is there enough thyroid in you? And if it interprets that there is not enough thyroid in you, it sends out chemicals that direct the thyroid gland to make more thyroid. So the chemical that part of the brain sends out to tell the thyroid to make more thyroid is called thyroid stimulating hormone. Conversely, so if you have low thyroid, if the brain in its central location up in your brain, if the hypothalamus in the central location up in the brain interprets that you are not having enough thyroid in your system, it will start making large amounts of TSH because it's going to start screaming at your thyroid to make more thyroid. Okay, so high TSH means that you actually have low thyroid. I know that's confusing, but I just want you to understand. It's like a parent with a misbehaving kid, and the kid is doing something dangerous, and the parent has tried talking in the normal voice at the kid, and the kid's still not responding, and they start screaming at the kid to do the right thing, right? So that's what the brain does. Through the hypothalamus pituitary, it makes large amounts of TSH and says, make more. All right. So high TSH means low thyroid. All right. All right. So then, and so one of the things that happens in Lyme disease is all of these excess cytokines interfere with the brain's ability to correctly determine if you have enough thyroid. And so therefore TSH measurements may or may not be accurate. You can still look at your thyroid hormone levels made by the thyroid, though, called T3 and T4. And in that situation, if somebody has a lot of symptoms of low thyroid, like they're cold all the time, they have hair loss, they ache all the time, they're really fatigued, they have dry skin, and even if their TSH is normal because the brain may be dysfunctional, it can't make the TSH it's supposed to. If you've got a lot of symptoms of low thyroid and your T3 and your T4 are in normal range, but they're on the lower side of normal range, it may mean that that's low for you. And in those are situations, even with a normal TSH, if somebody has a lot of thyroid symptoms, I'm going to give thyroid medications. I'm either going to start supporting the thyroid with ashwagandha, the herb called ashwagandha, or I might put them on something called desiccated or armor thyroid. Okay. All right. All right. So that's central hypothyroidism. All right. All right. Now, in peripheral hypothyroidism, what happens is so your thyroid gland predominantly produces T4, 90% of the hormone called T4, and 10% of the hormone called T3. All right. There are two major differences between T4 and T3. T4 has 4 iodine particles on it, and T3 has 3 iodine particles on it. That's one difference. The second difference is which one's active. So in the tissues, the thing that makes your tissues run and gives your tissues energy is the T3. So all that T4 out in your cells has to be converted over into T3. All right, so there has to be a conversion. Now, your T4 has a choice. It can become converted to T3, or it can be stored away as something called reverse T3. And in people with fatiguing illnesses, and we don't understand the full mechanisms on this, there is an inadequate conversion of T4 to T3 at the tissue levels. And some of it, you can kind of think more like, you can kind of think more in terms of like bears in winter. Bears go into hibernation to protect themselves in the harsh environment of winter. And maybe we go into hibernation, we make lots of reverse T3 instead of active T3 to slow down, to hibernate when we get under stress. Okay, that may be what's happening, all right? So the way that you figure out if you have this peripheral hypothyroidism is you have to measure a chemical called reverse T3. And reverse T3, if it's elevated, it says that at the level of your tissues, you're not converting enough of that T4 to T3, all right? All right. So the basic testing anyone should get to look at thyroid is TSH, T3, T4, reverse T3. And in addition, at least one time when you have chronic Lyme disease, you need to understand if your Lyme has triggered an autoimmune illness that is attacking your thyroid. And the way to do that, you have to get something called anti-TPO antibodies, basically, all right? And something called anti-thyroglobulin antibodies. You should do that at least once in your treatment, all right? So that's the minimal panel testing I would do, all right? Now, I know this is all very complicated. So I've written it down, and hopefully with this initial explanation that I've given you, as well as reading my article, you can get some input. And I even talk in the article about how do you treat each of these different conditions, okay? All right, so let me do a quick screen share for you. All right, so take a look in my Lyme guide and take a look in the hormone chapter. Where are we here? There we are. And this article called Hypothyroidism, the Best Test, Meds, and Vitamins lays out how you would go about testing for the illness. And it also talks about how you would go about treating the various kinds of thyroid illnesses. I give you supplemental options, supplements, and I give you prescription options as well too. Okay, all right. Good luck to you. All right, Joyce, take care. Hello, Matthias. Hello, Dr. Ross. I was close to remission, but since 3 months, a lot of Lyme symptoms are coming back. My doctor proposed 6 weeks of IV antibiotics followed by some oral antibiotics. My question is, how much time would I win by starting with IV instead of going straight to pills? Would it be weeks or months faster? It's doxycycline, flagyl, and ceftazidime. I have Borrelia miyamotoi. Let me see if there's any other question here. So, Matthias, if there's more that you've written, I don't see it, but let me just try to speak to this. Okay, so if I have I want to make sure that your doctor considered one thing. And hopefully, if you've been on part of my webinars long enough, you're about ready to know what I'm about ready to say. So, when things start getting worse after you've been doing better, it is not always Lyme that does it. And it's not always a relapse of Bartonella. It's not always Babesia. In fact, in my experience, about 80% of the time that somebody is getting better, doing well, or has gotten all the way well, and then they suddenly get a relapse, 80% of the time, it's because they've developed too many yeast in the intestines. Keeping in mind, even if you're doing everything you can, dumping probiotics in, being on anti-yeast medications throughout your treatment, like a statin or herbal anti-yeast medicines, you are still at a great risk of developing too many yeast in your intestines. Even if you've stopped all antibiotics, for those of you that have, and you're 2 and 3 years down the road and you suddenly start getting symptoms that look like Lyme back, it could still be from all those antibiotics you took 3 years ago, disrupting the good bacteria in your intestines that keep yeast under control. Okay, so what does yeast have to do with this, right? So let me just, I think many of you know from being here, but let me just cover it briefly. So again, when you have Lyme symptoms, the major reason you have symptoms is because your immune system makes excess cytokines, all right? And it's the excess cytokines that give you pain, make it so you can't think, give you fatigue, disturb your sleep, lead to mental health illnesses like depression and anxiety, give you joint pain, muscle pains, you name it. Hormonal dysfunction is all about the cytokines, okay? All right. Now, when you get a decline, it could be something else to trigger the cytokines. And 80% of the time, it's too many yeast in your intestines. So if you have yeast overgrowth in your intestines, too many yeast relative to what should be in you, that can lead to increased cytokines. In addition, those yeast release toxins that get into your nervous system and cause nervous system agitation and dysfunction as well too. Okay. All right. So you should consider if there might be too many yeast. The questions I explore with patients when I'm trying to figure out if it is too many yeast leading to the decline is I ask them things like, do you have increased sugar cravings? And they'll tell me, well, I avoid sugar. And that's not the question. The question is, do you have cravings? Okay. So even if you're doing a great job controlling sugar, if you suddenly find yourself wanting sugar a lot, that's increased sugar cravings. All right. Number 2, are you having any increased intestinal gasiness and bloating? Number 3, if you happen to have sugar, does it make you feel a lot worse than it normally would? Number 4, too many yeast in the intestines also release these toxins I was telling you about. And those toxins interact with the skin. And at the level of the skin, they can lead to increased skin rashes like eczema, pimples, and acne. Okay, so you get more skin problems. All right. And if you're a female, I want to know, are you having any problems with vaginal itching or vaginal discharge? All right. So if you're positive on a lot of those questions that I just asked before going to the IV antibiotics, I probably would look at treating for intestinal yeast overgrowth first. All right. And I would do at the minimum nystatin, coupled with 200 milligrams a day of fluconazole. There's other ways you can treat it too, and I'll show you that to you here. But you should ask your doctor if you all have considered, could this be too many yeast before you go down the pathway of IV antibiotics, all right? Now, in terms of effectiveness of IV antibiotics versus oral, in general, what I have found in my practice, and I've used quite a bit of IV antibiotics in my practice before, is that oral antibiotics stand a chance of getting you well about 85 to 90% of the time. IV antibiotics stand a chance of getting you well about 90 to 95% of the time. So there's a 5% chance they're going to be more effective. And there is a chance they may get you better quicker. There's a chance, small chance, okay? Not a huge chance, small chance, all right? But they carry risk. And the risks are cost, because usually insurance companies are only going to pay for one, not multiple, and they're only going to pay for about 30 days, usually, okay? So you have huge cost expenditure here, right? Secondly, when you do IV antibiotics daily, you're going to need to get some type of an IV line left in place. We call those PICC lines, or we call them central lines. And those PICC lines and central lines are prone to infection. So you're going to run a risk of having an access point that bacteria can work its way into your body and give you a systemic bacteria infection different than your tick-borne infections, all right? And then finally, there is the risk when you get a PICC line put in that the tip of that PICC line is a good place for blood clots to form. And those blood clots can break free of that tip, float into your lungs, and kill off part of your lung. And we call that a pulmonary embolism, right? So, I think when I looked at the research on this, over a 6-month period of time that somebody has a PICC line in, I believe it's about a 20 to 25% chance that we will have to remove that PICC line because a person has developed either infection in that line or they have developed a blood clot. It's a 15 to 20% chance, okay? So I don't pursue IV antibiotics loosely. And before I start thinking I'm going to put somebody on that, when I've got a treatment that's failing, I always am going to ask about too many yeast being there, okay? All right. I hope that gives you some useful information there, Matthias. Let me do a quick screen share here too. All right, so in terms of considering, do you have too many yeast and how do you treat too many yeast? Take a look at my yeast section here. Here are the two articles. One is called A Silent Problem Is It Yeast? The other one is called Kills and Prevents Yeast, a Brief Guide, okay? All right, so take a look at those and see if that will give you some useful information as well too, okay? Good luck to you. Hello, Susan. So experiencing hemolytic while trying to treat Lyme, BAPS, and BART. Recently, when drawing blood from my port, there were yellow-white chunks in my blood. What might this be? My hematologist had no idea. Could it be fibrin nest? Gosh, that sounds scary, first of all. That's why I'm making a face here, but I don't know. I honestly don't know. I mean, it would be useful if a pathologist could take a look at that blood and see if they can determine it. I haven't heard of that happening before, so I'm sorry I don't have a decent answer for you on that one. All right. It's a reasonable thing to wonder about, though, but yeah, I don't know. Good luck to you. Ooh, second part of Joyce's question, we answered that earlier. Hello, M. Hold on here just a minute. I'm going to have a sip of some water here. Hi, Dr. Ross. Acute Lyme disease on the site of tick bite is a classic red spot. Doxycycline, serrapeptase, biocidin binder has not caused any Herx reaction so far. Erythema migrans continues to enlarge. Some symptoms have improved. Is the doxy dose 100 milligrams times 2 too little for a person with 185 pounds? If double, 200 milligrams times 2, will the internal organs suffer? And a dummy question, is it only Lyme disease alone that develops erythema migrans, or can other co-infections produce it? Good question. There's no dumb questions. In fact, some of the questions that people ask me here get me thinking sometimes too. So there's never a dumb question. So you don't have to worry about asking it. So no, the erythema migrans, a true erythema migrans, and the only way I would know if it's a true erythema migrans is if I can look at it, okay? But a true erythema migrans is caused by Lyme. In fact, it is diagnostic of Lyme if that is what's there. All right. And there's many different ways it looks. So that's why I said I'd have to take a look at it to see. So keep in mind that usually when I treat for an acute tick bite like this and somebody has symptoms of Lyme, I'm usually going to treat for about 60 days. If they have erythema migrans or if they have symptoms of acute Lyme, I'm going to treat actually 6 weeks to 2 months. Okay, that's what I'm going to do. Now, the infectious disease doctors are pretty much going to treat for 3 weeks, maybe 4 weeks, but sometimes it takes longer to get everything under control, even on doxycycline. So I want you to know that to begin with. Okay, now, you do raise an interesting point in that, is it because of your size, your weight? Do you need a bigger dose? And so I think that's an interesting point. Second thing I want you to know, and I'll come back to that point here in a minute, is when you treat Lyme disease acutely or chronically, about 90% of people will develop that Herxheimer reaction you talked about, but about 10 to 15% of people don't. And they get better still anyhow. So not getting a Herx does not mean that your treatment's not working. Okay, I just want you to know that. Okay, and sometimes it can take a few weeks for things to turn around, even acutely. And when you are symptomatic like this, you have to, I usually think of a 6 week to 8 week treatment is what I look at doing. Okay, all right. Then, because of your size, if you wanted to give this even a better chance, I would consider going to 200 milligrams twice a day. All right. In terms of, is there a greater risk to your organs? The organ that could have some increased risk is your kidneys. Sometimes doxy can lead to some kidney irritation, but the way to approach that would be after a couple weeks of being on it at 200 milligrams twice a day, get a kidney blood test and see how your kidneys are handling it. Okay. They're doing well by 2 weeks. You're probably going to be fine with it. Okay. The other organ that has difficulty with doxycycline is your stomach, because it's going to nauseate you probably. And so the way around that is just take it with food, even though the pharmacist says you got to have it on an empty stomach for best absorption. You can have it with food, but you don't want to have it with calcium containing supplements or calcium loaded food. And that would be dairy products basically. Okay, so you want to avoid taking it with those, but you can have it with other food to avoid the nausea that might happen with it. Okay, all right. And then finally, the third organ system that can be affected by doxycycline is your skin. So what happens with doxycycline in your skin is you can sunburn more easily on it. All right. So, and that probably goes up just a little bit. The chances of sunburning goes up if you're taking a higher dose. But yeah, I think it's a reasonable thing to think about, given that your symptoms are still worsening, increasing the doxycycline dose. Okay, I think that's a reasonable thing to consider doing. Okay, all right. Good luck to you. Hello, Tyler. See, I tested positive for IgG bands 23 and 41 on Igenix immunoblot, which is a positive test according to Igenix criteria. My LMD said band 23 IgG can cross-react with Epstein-Barr virus, but I can't find any information supporting that claim. What are your thoughts regarding the cross-reactivity claim? So your physician is wrong if it was the immunoblot that was done. Now, if it was the older way of measuring these antibodies called a Western blot, there is a potential for that. Okay, so let me talk about the differences in this. All right, so it is true that there are some viruses that make antibodies that can also attach to Lyme protein. So when we do an immunoblot or we do a Western blot test, what we're doing is we're taking proteins from the germ and we're seeing, do you have antibodies that attach to those proteins? All right. And we're not differentiating what kind of antibodies they were. We're not differentiating whether they're an Epstein-Barr or whether they're a Lyme antibody. We're just seeing, do you have any kind of antibody that attaches to that protein? All right. Now, in an immunoblot, the way that those proteins are developed is we have genetically programmed bacteria in a lab to produce modified Lyme proteins to see if you have antibodies that will attach to them. And the way that those proteins are modified in the lab is they remove the amino acid parts that also attract Epstein-Barr virus antibodies, human herpes virus type 6 antibodies, okay? So yes, there is that risk, but in an immunoblot, it's completely removed. Those amino acids that would hold on to an antibody against a virus are not even in the test, okay? So now if it's a Western blot, they use whole Lyme proteins, not modified Lyme proteins, and there is a small risk. But the way we deal with that, not getting a false positive because of a virus antibody, is you have to have antibodies against two proteins. So the 41 increases the chances that 23 is not a false positive. Okay, all right. But again, if this was truly an immunoblot that you had done, the test called a Lyme immunoblot, which came out about 2 years ago from IGeneX, that test, there is no chance of having a false positive because of viruses. All right. All right. Good luck to you. Hello, Sandra. Hi, Dr. Marty. Thanks so much for your help. You're welcome. I have had Lyme on and off for years, especially recently. I've had COVID positive IgM, EBV, and shingles IgM positive recently. My doctor prescribed Valtrex, and I'm herxing. Is it normal to herx? And is it useful treating positive IgM? I don't know where to start. Can I treat the viruses and Lyme simultaneously? Thank you. Let me read this again here, just a minute. So the way I'm interpreting the way you wrote this, you're saying, recently I've had COVID positive IgM EBV, which I think you mean it's an IgM for Epstein-Barr virus, and shingles was IgM positive too. My doctor prescribed Valtrex, and I am herxing. Is it normal to herx? And is it useful treating positive IgM? So IgM, so shingles is due to reactivation of the chickenpox virus, which is a type of a herpes virus, okay? And the Valtrex is useful at lowering that viral load. Regardless of whether it's IgM positive or not, if you actually have shingles sores, you have an active infection. And therefore, just on that alone, being on the Valtrex is a good idea. And the herxing could be from killing the reactivated chickenpox virus. That's all right. So that may be what's going on there. Okay. All right. In terms of Epstein-Barr virus and IgM, if an IgM is positive in Epstein-Barr, it usually means acute infection. And so maybe you recently got it. Instead of reactivated, maybe it means you recently got another infection. Maybe, okay? In terms of Valtrex and its ability to kill Epstein-Barr, Valtrex was not designed to kill Epstein-Barr. And Valtrex is not a universal kills any kind of virus drug, okay? So I know some of my colleagues use Valtrex to treat Epstein-Barr, but I don't understand why. Because it's not designed to treat that kind of a virus, all right? I suspect from what you've written here is that the herxing is coming from killing your reactivated chickenpox, which we call shingles, all right? All right, good luck to you. And by shingles, I mean if you've had the skin lesions that we call shingles, okay? All right. Good luck to you, Sandra. Hello, Dan. Let's see. What is the best test for syphilis, and what should a patient do with false negative? Boy, it's been a long time since I've had to test for this. I don't know off the top of my head. If I look at it quickly, it'll come back to me right away, but I'm not going to be a good source. I'm blanking on that one right now. I'm sorry about that. All right. It's one of those things I used to look at a lot. I used to work with homeless people on the streets of Washington, D.C., and having syphilis either acutely or chronically, unfortunately, was a big thing. And so I was like expert at that time, but I'm blanking on it right now. So I apologize for that. Good luck to you, Dan. Hello, Eileen. Let's see. Is there anything in addition to your herbs of Hutania and Siddhakuta and quercetin and curcumin that you should do if you're having issues with bark getting into your shin bones? Mine wakes me up at night with excruciating pain. They do not hurt during the day. Thanks for all you do for us. All right. So, one of the symptoms that can indicate Bartonella, active Bartonella, that I have not listed before, but it's true, is if you get bone pain or shin pain, that usually is a sign. There isn't anything specifically you do for it other than using your herbal antibiotics or prescription antibiotics to treat it, okay? The Siddhakuta Hutania is... the Siddhakuta and Hutania is useful at treating for growing Bartonella, but the one thing that you are missing is a treatment to cover for hibernating or persister Bartonella. And so in my protocol, my Ross Lyme support protocol, in that section that's there on approaches to treating Bartonella, and even Lyme, I also suggest that in addition, starting something called liposomal cinnamon, clove, oregano. And I'm sorry. When you may notice my eyes are all over the place. My camera's up here, my computer's down there, and I keep wanting to look at myself on the screen instead of the camera. I'm trying to retrain myself on this one. Okay. Anyhow, so Siddhakuta Hutania are probably best for treating growing Bartonella. But also, we now know that there are these persister forms as well, too. So what I like using for that is a product that has a combination of essential oils in it called liposomal cinnamon, clove, and oregano essentials. It's made by a company called Doctor Inspired Formulations, and it's 1 capsule 2 times a day. Those oils that are in that capsule have been shown to treat both growing and persister forms of Bartonella. They can even treat growing and persister forms of Lyme too. So you might want to look into doing that as well too. Okay. And then I'm afraid I don't have any other ideas. I mean, if the pain is severe enough, you may want to talk to your regular doctors about either getting on some anti-seizure medicine called gabapentin or Lyrica to manage the pain at night. So anyhow, you might want to talk to your doctor about how do you manage that pain separate from killing the infections. Okay. All right. Good luck to you. Hello, Deb. Let's see. Does having 3 Borrelia strains, Borrelia greeni, Afzelii, and Burgdorferi, more serious and difficult to treat? What is the best order during the day to take meds, herbs, supplements to get the best outcomes? Specifically, antibiotics, antimicrobial herbs, cyst busters, biofilm busters, binders, detoxes, probiotics, and or away from food, any other category suggests. Is the ingredient serrapeptidase and the biodisrupt the same as serrapeptase? So I don't know if serrapeptase and serrapeptidase and biodisrupt are the same. I don't know that one off the top of my head. In terms of, we don't have any science that says if you have more than one strain of Lyme, that it's any worse than having just one, all right? You treat them all the same anyhow, but we have no data that says having all three makes it worse than the other. All right, so I just want you to know that. I don't know, and clinically, I don't know. I haven't had that as an experience. So, boy, I'm going to pass on telling you when the best time is to take certain things. I'm going to suggest you talk to your doctor about that, because I really would need to see the names of what you're taking, and I can figure out what can be mixed better. I know you've tried to tell me that here, but it's not in a way that I can organize it. I would actually need to know the actual products that you're on too. Okay. All right. Good luck to you, Deb. Hello, Alexa. See, I'm currently on 2 milligrams of IV Rocephin daily. I understand that using multiple antibiotics at once to attack from all sides is effective. So should I be on an oral or multiple oral antibiotics as well? Is doxy always necessary? Is Rocephin IV alone enough as the antibiotic portion? I'm on herbals and doing other things, my immune system as well. There's a second part to your question. Do I need a biofilm enzyme product in addition to herbals? And can you overdo herbals by using too many at once and mixing them together? Okay. So in terms of the best outcomes that I see is if you, so in terms of the Lyme germ, in terms of Borrelia, let me talk terminology with you real quick so you understand what I'm going to say here in a minute. So we recognize that Borrelia exists in 3 different appearances, 3 different looks, okay? There is a spirochete, that's the corkscrew-looking thing you probably have seen on the internet. There's a microscopic cyst form of the germ, and there is a form of the germ where the germ loses its outer covering and it moves inside of cells and lives there. We call that intracellular or L form. The best treatments at eradicating Lyme will target spirochetes, intracellular, and cyst forms all at the same time, all right? Now, this idea of intracellular Lyme and cyst Lyme is not accepted by the standard infectious disease doctors. They ignore the science. So all that they want to do is give you something that treats spirochete, and that is the IV ceftriaxone. Now, IV ceftriaxone, Rocephin, only works at spirochetes living outside of the cells. It does not do anything for intracellular, and it does not do anything for cyst Lyme, okay? At a minimum, what I usually would do with my patients that are on IV Rocephin is I would use that to get at the spirochete, but to get at cyst Lyme and to get at intracellular Lyme, I would also put them on metronidazole, also known as Flagyl, or I would put them on tinidazole, also known as Tindamax. Those are brother-sister drugs of each other. And that's a useful way to go after cyst and intracellular. Okay, all right. That's what I would probably do as a minimum. I'm not sure if you're going to be able to get your doctors to do that for you. All right. In terms of that ceftriaxone, I have mixed it with herbal antibiotics before. And for Borrelia, herbs that are useful about treating all 3 forms of the germ, and one of them would be useful against treating those persisters I was telling you about earlier, would be cat's claw. And you can mix that with Rocephin, meaning you don't mix it in and inject it. I mean, you can take it in addition to taking the Rocephin, okay? So cat's claw is good for treating spirochete, intracellular cyst, and then it can treat the different growth states of Lyme, which is growing Lyme, which Rocephin does, and hibernating or persister Lyme, which Rocephin does not. the cat's claw can pick up those persisters as well too. All right, so that's something to think about. Yeah. So in terms of the so to answer that part of your question, can you do too many herbs and by mixing them together is there harm? I would need to see what they are. So I'm sorry, I'm not going to be able to answer that one for you. Okay. All right. Good luck to you. Hi, Dan. If a patient has been rewarded with SSDI and a doctor has submitted paperwork that the patient is permanently disabled, what is the time frame? How many years after the first payment that a patient will undergo a review to determine if it is eligible to continue receiving disability benefits? I don't know that one off the top of my hand, Dan. You probably could find it by just doing a quick search on the internet, okay? Good luck to you. Hello, Joyce. Hi, Dr. Ross. I saw info about your online group, but unless I missed it, there is no mention of which day of the week this group meets. I want to be sure this is not conflict with my work schedule. Thank you. So, Joyce, let me just do a quick screen share and tell you that it's all the time. Think of it as a Facebook group that is always on, and you can leave comments. There are certain things that do have a time that they happen, though. So I'm gonna take you and show you what the group looks like. Okay. Oh, I got to do a screen share. Okay, so this is Lyme United. Think of it as a Facebook group, but not on Facebook, okay? And in Lyme United, we have different forums where members can interact. So there's this one forum called Member to Member, where any member at any time can write a question or request support from other people living with Lyme disease. And this is always on. You can drop your comment at any time and somebody will comment at some other time, okay? There is a forum here called Say Hello, where you introduce yourself to others, and it's a great way of jumping in and letting people know who you are. There's a forum we have called Wins on Wednesday. So Wednesday, I'd like people to tell us what's going well so that we can all learn from what happened. And this has become quite popular. We get all kinds of people that post here about something going well or some good things for other members to consider. Okay. And that's every Wednesday throughout the whole day of Wednesday that takes place. There is a section called Office Hours with Marty Ross MD. And this is a written question and answer session. And this takes place, basically the way this forum works is throughout the day at any time, you can write a question to me. And then I look at all the questions that came in over the last 24 hours, and I spend 1 hour between 12 p.m. and 1 p.m. Central Standard Time writing responses to as many questions as I can in that hour. So you can come back at any time and look at those responses, or you can see as I post those responses between 12 and 1, okay? Right. There is only one thing right now that is time dependent, and that is this live forum. It's a question and answer forum called Ask Marty Ross MD Live, and this is between 1 and 2:30 p.m. Central Standard Time. And in this, I take questions I actually do a live interview of 2 people where we do a case discussion of what's going on with them. Each week, I interview 2 people, give them answers. The whole community jumps in and gives them ideas on what to do. And we collectively come up with a good response for the person's problem, right? And during the last half hour, we do an open question and answer where anyone can ask me directly. It's all done in a Zoom room, so we see each other as well, too, okay? And then finally, we just opened up a new space, and I'm still waiting for person to host their first event, but members of Lyme United can host their own events. And there's some ideas that people are kicking around, but we now have a space where members can do that as well too. All right. So anyhow, it's always on. All right. There is a couple of things in there that have a time sensitivity. The wins on Wednesdays, you post that on Wednesdays, and the Ask Marty Ross MD Live is only an hour and a half, but we've got all those other places that you can learn, get comments, get help, get good support. Okay. All right. Hope that answers your question. Good luck to you, Joyce. All right, everyone, that's it for me for tonight. I've got a couple of Basenjis, as you know, that my dogs, that's their picture right back there. That's their painting. I had to figure out something here of interest to put back there so my Basenjis now have a spot on the wall back there. But anyhow, I've got to get them out. But I've enjoyed being with you here tonight. Keep an eye out at your email tomorrow morning. Somewhere between around 9 to 9:30 a.m. Central Standard Time. I will send an email notification out telling you that the recording is ready to be watched and with a summary of what we talked about tonight. In addition, there'll be a link that you can sign up for next Wednesday's webinar as well too. All right. All right. Good night, everyone. Good to see you here.